Hello everyone. Today topic is very relevant to modern nursing practice, advancements in cardiothoracic nursing. We are living in an era where technology is changing healthcare faster than ever before, and cardiac nursing is right at the center of that change. So today we are going to explore exactly what those changes are, what new tools exist, how they are being used, and what challenges come with them. Let's begin. I am Brinda Ronika, working as a tutor in Triple M College of Nursing. By the end of today's class, we should be able to analyze the technological innovations happening in cardiac nursing, explain what remote patient monitoring is and how it works, discuss the telehealth applications used in cardiothoracic care, describe how artificial intelligence and machine learning are being used, give a brief overview of robotic cardiac surgery, and explain the challenges and future implications of all these advancements. Let's set the stage. Cardiovascular and thoracic nursing is at the forefront of modern healthcare. Think about this. Cardiovascular disease is the number one cause of death worldwide. Heart attacks, heart failure, valve disease, thoracic surgeries, these are not rare conditions. They are extremely common, and the nurses managing these patients carry enormous responsibility. Now, what has changed in recent years is that technology has stepped in to support that responsibility. The tools available to your cardiac nurse today, the monitors, the devices, the software, the surgical systems, are fundamentally different from what existed even 10 years ago. And as a nurse, you need to understand these tools not just to use them but to educate your patients about them, to advocate for them, and to identify when something is going wrong. That is the whole point of today's class. Let's now go through the major technological innovations in cardiac nursing one by one. We have five big areas to cover: remote patient monitoring, wearable devices, telehealth applications, artificial intelligence and machine learning, and robotic surgery. Let's take each one. The first and perhaps the most transformative innovation is remote patient monitoring, or RPM. So, what is RPM? It is the use of digital technology to collect health data from patient who is sitting at home and transmit it to the healthcare provider in real time. The patient does not need to come to the hospital. The nurse or doctor can see the data from a computer or phone. Now, why is this so powerful for cardiac patients specifically? Think about a patient who has been discharged after a heart failure admission. They go home, but heart failure is unpredictable. Fluid can accumulate again, blood pressure can rise, weight can increase overnight, which is a sign of fluid retention. In the old model, you would not know about any of this until the patient came back to the emergency department. But that time the situation has already deteriorated. With RPM, the patient has sensors at home, a blood pressure curve, a pulse monitor, a weighing scale, all connected to an app or a device that sends readings to the hospital system. If anything crosses a threshold, a nurse gets an alert immediately and can intervene, call the patient, adjust the medication, arrange a clinical visit before it becomes a crisis. So, RPM allows nurse to monitor vital signs, track medication adherence, and follow symptom progression, all without the patient leaving home. It reduces hospital readmissions, improve patient outcomes, and gives both the patient and the care team peace of mind. This slide gives you a visual of how remote patient monitoring works in practice, the flow from patient to device to data transmission to the healthcare provider. Next one is wearable devices. It's connected to RPM is a world of wearable devices. You all know smartwatches and fitness trackers. Many of you probably wear one right now. But in the context of cardiac nursing, these devices are far more than just step counters. Modern wearables can monitor heart rate continuously, detect irregular rhythms like atrial fibrillation, which is a major risk factor for stroke, measure blood pressure, track physical activity levels, and even monitor oxygen saturation. For a cardiac patient, this means the nurse and doctor can get insights into the patient daily life that were never possible before. Not just a snapshot taken in a clinical every 3 months, but a continuous real-time picture of how the patient heart is behaving throughout the day and night. For example, a patient comes in and says they have been feeling occasional palpitations. In the past, had put them on a Holter monitoring for 24 hours. Today, the smartwatch data from the last 3 weeks can already show whether they were episodes of irregular rhythm, how frequent they were, and in what context, during exercise, during sleep, during stress. As a nurse, you need to understand wearable data, explain it to patients, and recognize when the data is signaling something that needs clinical attention. This slide shows examples of wearable cardiac monitoring devices, from consumer smartwatches to clinical grade wearable ECG patches. Note the range from devices patient by themselves to device prescribed by doctors. Okay, next, telehealth. Telehealth means delivering healthcare services remotely through video calls, phone consultations, or digital platforms without the patient physically being present. In cardiovascular and thoracic care, telehealth has become absolutely indispensable, and the COVID-19 pandemic accelerated this dramatically. Hospitals that had been slow to adopt telehealth were suddenly forced to, and what they found was that it worked extremely well for many types of cardiac consultations. What can telehealth do? It facilitates virtual consultations. A cardiologist in a city hospital can review a patient in a rural village. It enables remote diagnosis. ECG data, echo reports, and lab results can all be shared and reviewed remotely. It supports patient education. Nurses can conduct structured teaching sections for patients with heart failure, teaching them about fluid restriction, daily weighing, medication adherence, and when to seek the emergency care. Think about this from an equity perspective. In India, many patients live hours away from the nearest cardiac center. Telehealth breaks that barrier. A nurse using a telehealth platform can reach patients who would otherwise receive no follow-up care at all. That is a massive advancement. As nurses, our role in telehealth including conducting virtual assessments, educating patients through digital platforms, documenting telehealth encounters accurately, and ensuring patients have the technology literacy to use these tools. Now we come to a topic that is generating enormous excitement and also some concern across all of healthcare: artificial intelligence and machine learning. Let me explain this simply. Artificial intelligence (AI) refers to computer systems that can perform tasks that normally require human intelligence. Things like recognizing patterns, making decisions, and predicting outcomes. Machine learning or ML is a type of AI where the computer learns from data. The more data it sees, the better it gets at making predictions. In cardiothoracic nursing and medicine, AI is being applied in several powerful ways. AI algorithms can analyze ECGs and detect suitable abnormalities, arrhythmias, ischemic changes, sometimes more accurately than a human reading. They can analyze echocardiograms and CT scans, identifying the structural abnormalities in seconds that might take a radiologist much longer to detect. AI can also predict patient outcomes, feed it the patient age, lab values, medication list, vital signs, comorbidities, and it can calculate the risk of deterioration, rehospitalization, or death. This helps nurses and doctors prioritize which patients need urgent attention. In nursing specifically, AI-powered clinical decision support tools are being integrated into electronic health records. The system might flag that patient potassium levels combined with their digoxin dose is risky, or that a patient worsening trend in vital signs matches a pattern associated with sepsis. Does AI replace the nurse? Absolutely not. AI processes data. The nurse provides human judgment, empathy, communication, and holistic care. Things no algorithm can replicate. But AI can make the nurse more effective by processing vast amounts of data and surfacing the most important signals. That is the partnership between AI and nursing. These slides show visual examples of AI being applied in cardiac imaging and monitoring, from AI assisted ECG interpretation to machine learning models predicting cardiovascular risk. Notice how these systems present information to the clinician rather than replacing clinical decision making. The humans remains in charge. Next, robotic surgery. This is perhaps the most visually dramatic of all the advancements we are discussing today. In robotic assisted cardiac surgery, the surgeon does not directly operate with their hands inside the patient's chest. Instead, they sit at a console and control robotic arms which hold the surgical instruments inside the patient body. The robotic arms can move with far greater precision and in a much wider range of motion than human hands. What does this mean for patient? Smaller incision. We are talking about 1 to 2 centimeter cuts rather than opening the entire chest. Because of smaller incision, there is less trauma to surrounding tissue, significantly less blood loss, much lower risk of infection, and dramatically shorter recovery times. A patient who would have spent 2 weeks recovery from an open heart surgery may go home in 4 or 5 days after robotic surgery. Procedures that are being done robotically in cardiac surgery include mitral valve repair, coronary artery bypass grafting, and atrial septal defect closures. Now, what is the role of nurse here? Preoperatively, the nurse prepares the patient, provides education about the procedure and what to expect, and manages anxiety. Intraoperatively, nurses scrub and circulate in robotic procedures with require specialized training. You need to understand the robotic equipment, the instrument, the setup, and postoperatively, the nurses monitor for complications, manage pains, and facilitate the faster recovery that robotic surgery enables. This is specialized nursing, and as the technology becomes more widespread, more of you will work in settings where robotic surgery is a routine. This slide shows a robotic surgical system, typically the Da Vinci system in use. You can see the surgeon console on one side and the robotic arms positioned at the patient on the other. Study this because you may be asked to describe the setup of nurse role in robotic cardiac surgery. Now, all of these advancements mean nothing if nurses are not prepared to use them. That brings us to education and training. Specialized training in cardiovascular and thoracic care is more important than ever. The cardiac nurse today needs to understand not just anatomy and physiology, but also how to operate RPM systems, interpret wearable data, conduct telehealth sections, work alongside AI assisted tools, and assist in robotic procedure. Simulation based learning is a major component of this training. High fidelity simulation labs allow nurses to practice complex cardiac scenarios, managing a deteriorating postoperative patient, responding to a ventricular arrhythmia, operating monitoring equipment in a safe environment before they encounter these situations in real life. This builds confidence and competence. Continuous professional development is non-negotiable. The technology is evolving rapidly. A nurse who was trained 5 years ago needs to keep updating their knowledge. Conferences, workshops, online courses, certification programs in cardiac nursing. These are not optional. They are essential to delivering safe care in a rapidly changing environment. Addressing diversity and cultural competence is also a part of modern nursing education because the patients using telehealth platforms, wearing monitoring devices, and undergoing robotic surgery come from every background. Nurse must be equipped to communicate effectively and sensitively across cultural differences. And finally, nursing research. Nurse must not only apply these technologies but also study them. What works, what does not, what are the patient outcomes. Nurses who engage in research contribute to the evidence base that guides practice. You are not just consumers of knowledge, you are producers of it. Now, technology brings advancements, but it also brings challenges, and we have to address them honestly. Data security and patient privacy are major concerns. When patients' heart rate, blood pressure, and location are being transmitted continuously through a wearable device or RPM system, who has access to the data? Is it stored securely? Can it be hacked? These are real questions that healthcare organization and regulators are grasping with. As nurses, you must understand your organization policies on data security and ensure you handle patient data responsibly. Health disparities are another serious concern. Telehealth and RPM are wonderful, but they require smartphones, internet connectivity, and digital literacy. Elderly patients, rural patients, economically disadvantaged patients may not have access to these tools. If we are not careful, technology can actually widen the gap between the patient who receive excellent monitor care and those who receive nothing. Nurses must advocate for equitable access. And the role of the cardiac nurse in all of this is crucial. You are not just the user of these technologies, you are the patient advocate. You ensure that technology is being used ethically, that the patient rights are upheld, that the data being collected is being used for the patient's benefit, and that no patient is left behind because they couldn't afford a smartwatch. Future implication. Looking ahead, the future of cardiac nursing is extremely exciting. Virtual reality is emerging as a powerful tool both for nursing education and for patient rehabilitation. Imagine a cardiac rehabilitation program where a patient uses a VR headset to exercise in a virtual environment while their vitals are monitored in real time, or a nursing student who learns to scrub for open heart surgery through an immersive VR simulation before ever entering an operative theatre. AI will continue to evolve. We'll see predictive algorithms that can identify a patient who is going to develop heart failure weeks before symptoms appear. Based on subtle patterns in their daily data, we'll see AI tools that helps nurses personalize patient education, delivering the right information in the right format at the right time for each individual patient. The integration of genomics, understanding how a patient genes influence their cardiovascular risk, will also become part of nursing practice. Nurse will need to understand what genetic testing means for their patients and how to console them. The future nurse in this field will be technologically fluent, research informed, ethically grounded, and deeply human. Technology will handle more and more of data processing. The nurse irreplaceable value will be in relationship in the assessment, the communication, the compassion, and the advocacy. Let's close. Today we cover the major advancements in cardiac nursing, from remote patient monitoring and wearable devices to telehealth, AI, and robotic surgery. We discussed how nursing education must evolve to meet these changes, the ethical challenges we must navigate, and the exciting future ahead. The central message is this: technology is a tool. You're the nurse. The tool makes you more effective, more informed, and more capable of delivering excellent care. But the heart of nursing, the human connection, the clinical judgment, and advocacy that remains yours. Thank you.